Men's problems with sex. Let's start with size. You might even find a woman who doesn't have a big problem with the fact that you have impotence. There are many men who have this mental block about condoms. Maybe it's someone who doesn't make you feel accepted, who puts you down, who makes you feel bad. It's completely logical that your friend refuses to cooperate. And he's right. Premature ejaculation is almost always a psychological issue. There are some people who don't actually have a problem objectively, it's only in their head, and then there are problems that might actually be a bit more objective. The best thing is to choose a partner and make sure she's a sane and welcoming person before going to bed with her, so as to avoid any scenes of madness. If a woman fakes an orgasm, she's the one who loses out, so... As you saw during the preview, in this video I'll show you an excerpt from one of my most popular courses, which is called Classroom Sex. Classroom Sex explains everything you need to know about sex from A to Z, and it's a course specifically designed for everyone, from people with little or no experience to those who are already advanced and experienced in this field, but who can still refine their skills or learn new things they might not have had access to before. In fact, many men think they know everything about sex, but often they only know superficial things and lack the deeper understanding. In Classroom Sex, I also explain how to go from the first date to sex without missing the right opportunity, and then everything related to sex in theory, whether it's for a casual relationship or a committed one. So, this includes how to engage in light foreplay and then how to actually have sex in practice as well. So, all the best tips on how to do what you enjoy most and how to give pleasure to a woman. In this excerpt that I'm about to show you below, I'll talk about the most common sexual problems that affect men. I specify this because in the full course, I also address sexual problems related to women. I'll let you get to the video right away, but first I want to point out that below in the description, if you're interested in watching the entire course, you'll find the link to the explanation page where you can see in detail what each module covers. I'll also leave you a discount code just for you because you're a loyal follower of the channel. For those who watched Classroom Rec Dating, I'm wearing the Scorpion t-shirt again this year because by now it's become a tradition. So let's get to men's problems with sex. Let's start with size. It depends on what size are we talking about, obviously. Because if someone is micro-endowed, and by micro-endowed I mean just a few centimeters, like 3 or 4 centimeters, well, clearly that could be an objective problem, and in my opinion it should be addressed with the appropriate professionals, so a sexologist, a psychologist, and so on, because that can actually cause some problems with sex on a more or less objective level. I mean, obviously, if she wants to, a woman can have an orgasm even with just 1 centimeter. She can have an orgasm even just from being touched if she wants to. But clearly, in everyday sexual life, that might not be enough unless the feelings involved are that strong. So, in that case, it's better to get support from someone. Let's say that from 8 to 12 centimeters is below average, but it's still an adequate size if you want to have sex. From 12 centimeters and up, there are no excuses. In short, there are no problems. Clearly, it also depends on the type of woman, because those who in the Kama Sutra are called elephant women, meaning those who may have a much larger and deeper vagina, obviously might have difficulties with a man. I think he's called the rooster in the Kama Sutra, basically a man with a small penis. Because she might actually feel very little physically, or in any case, not really enjoy it, okay? So while it's true that the mind, the psychological aspect is the dominant part, we also have to consider that there can be some difficulties. In that case, you should talk about it with your partner. If, on the other hand, the size is very small, let's say below 7 to 8 centimeters, in that case, I repeat, it's better. I'm talking about when erect, I mean when erect. In that case, it's better to consult a specialist so you can discuss it with them, because these are rather sensitive issues. Let's talk about impotence. Impotence comes in 3 forms. Impotence related to medical conditions, impotence caused by condoms, and psychological impotence. As far as medical conditions are concerned, it could be that someone has neurological problems, various types of illnesses or accidents, and therefore there is clinically confirmed impotence. Clearly, they need to be followed by specific professionals, such as doctors and possibly psychotherapists, because there are important issues involved. Okay, so these are delicate dynamics. What I can tell you is that if you really find the right woman, because even if you have a physical handicap, you feel strong inside yourself, very difficult thing. You might even find a woman who doesn't have major issues with the fact that you have impotence. There are also women who actually prefer to have a white marriage, not having sexual relations within the couple. And even if the woman does want to have sexual relations because she loves you so much, even if you are impotent, she can still have fun. There are hundreds of thousands of sex toys you can use. And if you want to please her, you can still make sure she has a good time. In that case, obviously, for psychological support, you should seek help from someone, because if you're not able to handle this situation well, and that's perfectly normal, you clearly need to be followed by a professional. I'm pointing this out because there are people who have these issues, and they're not at all rare. The other type of impotence is impotence caused by condom use. There are many men who have this particular mental block about using condoms, mainly because they feel trapped, because they feel forced, constrained, and they say they can't feel anything, and so on and so forth. So on a psychological level, they may lose their erection sometimes just by hearing the word condom mentioned, just the mere thought of putting on a condom. Some try, they put on the condom and lose their erection. Obviously, this is a psychological problem, so it's important to understand what the root issue is, what the resistance is. Okay, behind the loss of erection at the moment someone puts on a condom. The causes can be many. Clearly, almost all psychological in nature, usually linked to not wanting any limitations. But guys, let me tell you something important. Not using a condom often compromises pleasure. If you're not in a secure relationship, that is, where you've both been tested and where a possible pregnancy isn't an issue. Because if you don't use a condom, you're there worrying, oh God, I have to be careful not to come, I have to watch out for diseases, I have to make sure she doesn't get pregnant, and so on and so forth. And the woman doesn't enjoy it either. I mean, if the woman is afraid that you might accidentally come inside without pulling out, or that she might catch some disease, then you both experience the encounter with anxiety. Obviously, this doesn't help with reaching orgasm either, quite the opposite, okay? So, in short, if you have a specific problem with condoms, try to find a way to solve it. And then let's talk about impotence, where someone doesn't have a diagnosed clinical issue. Okay, so a psychological impotence, which I call impotence from not having found the right partner, because it could be that you don't like the woman enough, or maybe the woman isn't able to make you feel comfortable enough, or perhaps she's someone who doesn't make you feel accepted. who belittles you, makes you feel bad, treats you poorly, and clearly, under these conditions, it's completely logical for you to feel at least a bit anxious, and obviously for your friend to refuse to cooperate. And he's right. I would do the same. So you clearly need to find someone with whom you have a real connection. It has to be someone who is on your wavelength. Let me give you an example. I have a friend who had problems with impotence, as I was saying, and then by digging a little deeper, I understood what his problem was. He didn't always have problems with impotence, but practically almost always. Why was that? Because most of the time, he chose women who weren't right for him. I mean, he was a very intelligent, very deep person. But for some reason, no one really knows why, he was sexually attracted to what I call airhead club girls, women without any brains who had totally superficial sex. And in those situations, he just couldn't feel comfortable. So he couldn't maintain an erection. Or he would keep it for a little while and then lose it because he couldn't find any real connection with the person. Then let's talk about premature ejaculation and delayed ejaculation. There are also men who have the opposite problem. I've come across them. For me, it's not a problem, but for some people it is. So let's say that premature ejaculation is almost always a psychological issue and rarely a physical one. It's caused by hypersensitivity, but usually it's mainly linked to a psychological problem. So someone might say, maybe I'm very sensitive, but sometimes the sensitivity in the penis is also connected to psychological and mental perception, okay? Sometimes it can depend on anxiety. Other times it can also be due to too much mental activity related to imagination or too much expectation. So a certain imbalance and inability to control oneself. And sometimes also because a person is overly emotional or maybe because they are inexperienced. And so the novelty can cause almost immediate ejaculation, or perhaps because they have waited a long time before having sexual intercourse. If you want, you can use a delay condom, which is specifically designed to help prolong the experience. And of course, it's important to find a way to communicate openly and honestly with your partner in a manner that works well for both of you. Additionally, make sure to clearly identify and establish the right rhythm together so that both of you feel comfortable and satisfied, okay? For example, I once dated a guy for quite a long time, and at first he was really worried because he told me in confidence that he considered himself to be someone who had premature ejaculation. By premature, he specifically meant that he could only last about 5 minutes or at most maybe 10 minutes. In reality, true premature ejaculation is a matter of seconds or up to 3 minutes, but let's say that even under 10 minutes is sometimes considered short. In that case, we worked on it together, and it was actually very simple in the sense that in his particular situation, he had, let's call it, a sort of pseudo premature ejaculation because he was very frantic during sex. He was trying to perform at a pace like a porn actor, in quotes, which, by the way, I don't even like then. Actually, by working on it together, we found a slow, relaxed approach where he felt comfortable and could last even 45 minutes. No problem at all. He even managed an hour once, so there was really no issue whatsoever, honestly. He was almost surprised by it because he thought he was someone who came quickly, but in reality, it was just a matter of finding the right approach, okay? Otherwise, there are various other techniques. You can masturbate beforehand or have your partner give you oral sex first so that you've already come once and therefore the second time when you have penetrative sex, you'll last longer. Or you can slow down your own rhythm or even stop altogether. There are men who, in order to lower their arousal and last longer, stop, pull out, perform oral sex on the woman, and then, when they're calmer and more relaxed, start again, okay? On the other hand, for those who suffer from this non-problem of delayed ejaculation, well, I'm joking, of course. It only becomes a problem if the woman doesn't like long sexual intercourse for some strange reason that I can't understand. I'm joking, obviously. Or maybe because she feels pain, etc. There can be various reasons, or if the man truly can't climax, because there are also men who can't orgasm, and in that case, I think you should start considering it a problem. If after an hour you're still struggling to finish, if it happens within an hour, in my opinion, it's not really delayed ejaculation, it's just that it takes you a bit longer, that's all, but that's fine. Generally speaking, since women usually take a while to reach orgasm, the longer it takes, the better. I should clarify that delayed ejaculation can sometimes also be caused by over-control. That is, when a man is overly controlling, very vigilant, and obviously can't focus on sex because he's concentrating on his technical performance, making sure, I don't know, that everything around is in order and so on. He gets distracted. Or sometimes a man has trouble reaching orgasm, even if he has prolonged things too much by holding back ejaculation when he was more or less about to climax. And even in that case, it's not a cause for concern because it only depends on that specific moment. Generally speaking, these are issues that, if they become serious problems that significantly affect the relationship, should always be discussed with a professional, even when it comes to delayed ejaculation, because there could also be a physical problem involved. Let's then talk about shame. That is, the fact that some men feel embarrassed to show themselves naked, or maybe because their penis isn't erect, or it's not big enough, or whatever else. In short, this is an issue that affects both men and women, because women also have 100,000 hang-ups. There are some people who don't actually have a real problem. It's only in their heads, and that's something that should be pointed out as well. And then there are problems that might actually be a bit more objective. So if someone is a bit more, a little embarrassed, maybe because they're not in shape or because they don't have a nice looking penis or whatever, in that case, you need to, of course, you do some work on a more psychological level, but you also need to find a partner who is accepting, okay? So a woman who is able to care for you with your limitations and any small flaws you might have, okay? As for rejection, that is, the rejection that a woman gives to a man, it can happen if the woman doesn't feel accepted or attracted. She might also withdraw and reject the man. If the man does something the woman doesn't like, she might also reject him, sometimes even verbally, by saying enough. That is, I don't want to see you anymore, I don't want to have sex with you anymore, or I don't know, get dressed because I've lost the desire. I mean, sometimes women can be a bit unpredictable, guys, so you could easily find yourself in a situation like this, okay? And if you're looking for an easy way out of this problem, there isn't one, because nobody likes rejection, okay? So the best thing is to choose a partner and make sure she's a sane and welcoming person before you go to bed with her, so you can avoid any crazy outbursts, okay? But if you do find yourself in that situation, you need to react by protecting yourself. That is, you shouldn't leave with your tail between your legs if a woman says to you, I don't feel like having sex anymore. That's it. Get dressed, go home. I don't know. Let's just pretend. I mean, you shouldn't say, oh, sorry, or things like that. But instead tell her, listen, first of all, calm down and behave civilly like a human being, not like an animal. You know what I mean, right? And call her out if she's being inconsiderate towards you, because this helps you avoid completely destroying your self-esteem. Now let's talk about clingy women after sex. If you notice that a womb, this is an issue I've listed among men's problems because in reality, it's not a problem for the woman, but rather it's something that affects the man. So, if you feel that a woman is clingy after sex, it's quite clear that there really isn't a strong foundation of affection for that person. So that's where the problem lies. You've chosen to sleep with someone for whom you don't feel even a bit of human warmth, and so you've just used her to satisfy some need of your own. There's also the case where the woman can be excessively intrusive. For example, maybe you're just seeing each other and after sex she starts telling you, "I love you. I want to have 6 children with you." In that case, she's crazy. So clearly, yes, that's a problem that needs to be handled. So, if you are the cause, that is, if you chose someone you weren't compatible with, you should resolve it on your own, possibly by ending things with that person. Otherwise, you risk hurting her. If, on the other hand, she's the one who did something inappropriate, you call her out and say, "Sorry, but I think you're going a bit overboard. Maybe it's better if we don't see each other anymore." That's it. Okay? If your instinct tells you to walk away, there's a reason for it. Okay? So it could be that you made a mistake in choosing the person, or it could be that this person is crazy. But in any case, if you feel the urge to run away, just leave, okay? Because there's no point in forcing something that isn't working. Then, regarding women who pretend to be satisfied, which I know is an issue that has really interested you all, I could do a separate lesson on that. No, let's say, as I've already said, obviously there's no real way to know unless you want to hook her up to electrodes or have something that measures her internal vaginal temperature. There's no way to know if a woman has really had an orgasm or not. So the best thing is, I know some of you here think you can tell, but I guarantee you that you can't know. I mean, it's truly impossible. Because if a woman wants to, she can fake it in such a way that it's impossible for you to know. In any case, you need to have enough communication and connection with the person, okay? Because if you're able to talk about it, you can be at ease. As I've already told you, there can be times when maybe the woman has a milder orgasm, or maybe, I don't know, maybe it's taking you a long time and she pretends to have an orgasm to hurry things up. I don't know. It could be anything. So, generally speaking, in this case, dialogue is what solves 90% of the problems. If you can't trust the person you're with and have a decent conversation, that's a problem. But in that case, the problem isn't that she's faking an orgasm. And anyway, always remember that if a woman fakes an orgasm, she's the one who loses out, so that's her business. Then there's also, though I don't think it concerns you, male hypoactive sexual desire disorder. That is, when a man doesn't feel like having sex. Obviously, unless it's a neurological or physiological problem, like hormonal imbalances, other issues, and so on, physical causes, the reasons can be depression, the use of antidepressant medications, or even drugs that interfere hormonally. For example, there are some medications, I won't name them, otherwise I'll get sued. But actually, it's well known. There are drugs that inhibit DHT so that the hair follicle doesn't get destroyed. So these drugs alter hormonal levels to prevent men from losing their hair, but some of them can also cause impotence. Or it could also be a sign if a man has little desire. Sorry, not impotence. Yes, impotence and also lack of sexual desire. Or it could also be that the lack of sexual desire comes from a deep, unconscious, internal signal indicating that perhaps the sexual path or the sexual relationship is not being followed correctly. Maybe the person isn't the right one, or the approach isn't the right one. If, on the other hand, there are problems related to pain in the pelvic area, the glands, strange things, see a doctor. Obviously, this is not my area, nor within my expertise. And finally, and get your questions ready, because now I'm going to open it up for questions regarding porn addiction and how porn addiction can ruin a relationship unless both people are porn addicts who have sex while watching porn movies and are both obsessed with that kind of practice. Psychologically, as you know, porn can create 1,000 expectations. It can really distort reality. It can create expectations about the kind of partner you want, and also performance anxiety. That is about the kind of partner you think you should be. Okay? Or if the brain in fact has gotten used to experiencing pleasure only through visual and video stimulation, it can also happen that when faced with a real woman, it feels awkward and unable to enjoy what's happening, okay? It can also happen that if someone has a specific standard for women, like I don't know, the busty one with implants or the one without a trace of cellulite or whatever, then mentally their desire might drop because reality is different from what they imagine in their head, okay? And so in this case, there are two options. One is to clearly see a therapist to understand if there's a bigger psychological issue. But first of all, what you can do, even on your own, is try to reconnect with reality and, above all, with acceptance, love, and affection for your partner and for yourself. These are, of course, things that a psychologist can explain to you in detail if needed.